Doctors are urging people to get their flu vaccines and COVID boosters as respiratory cases surge across the country. As we've reported, hospitals are already filling up. And with the holiday season right around the corner, health officials don't want things to get worse after families get together. Sarah Hamden spoke to a local doctor about what you can do to stay safe.
Flu, RSV, and COVID-19, three respiratory illnesses the CDC is warning could overwhelm hospitals this fall and winter.
Well, we've been bracing for this year's flu season for some time.
Dr. Patrick McHugh, Chief Medical Officer for Velocity Urgent Care, says they always prepare for a rise in COVID-19 cases this time of year as well.
I think the only thing that caught some of us by surprise, the impact of RSV on our pediatric patients.
According to the CDC, RSV cases have hit a 2-year high. McHugh is also an emergency physician, so he's seeing just how full hospitals are getting because of these three viruses.
It's impacting patients in the sense that wait times are up.
Now we're entering the holiday season with families coming together, so he encourages you to get both your flu vaccine and COVID-19 booster shot now to gain full protection before Thanksgiving.
I'm a big believer in the vaccination. I know that it's a hot topic for people, but I personally believe in vaccination.
If your doctor's office or local urgent care centers are filling up with sick patients, don't forget there are other accessible options like CVS or Walgreens. In the meantime, McHugh says they are bracing for what could become an even bigger rise in cases after the holidays.
Come early December or January, that we're starting to see these patients after being gathered in large groups to have increased number of illnesses that we're prepared to diagnose it and treat it.
Sarah Hammond, 13 News Now.
Just last week, CHKD in Norfolk told 13 News Now their emergency room is filling up quickly with RSV patients. It's an increase they say they haven't seen since some of the highest peaks of the COVID-19 pandemic. The CDC reports most RSV infections go away on their own within a week or two. But if your child is struggling to breathe or starts turning blue or gray, head to the ER.